I want to tell you a little bit more about Obama's health care reform. Come on, stick with me now. This affects you. If you get sick, I mean really, really sick, where do you go, Mr. Producer? If you get really sick, to the doctor? Wrong. Mr. Call Screener, you get really, really sick, where do you go? To the hospital. Yes, I know, it was a trick question. There are doctors there. But you go to the hospital, do you not? Well, we have a little problem under our new reform law that gives access to everybody and anybody, no matter who they are, what they are, if they have any money, they don't have any money. Everybody's welcome. Uh-oh. We may run out of some hospitals. Right here, I'm reading it in the Baltimore Sun by John Hartigan. And he says over the last few months, the Department of Health and Human Services has exempted a long list of unions and employers from an Affordable Care Act provision that would have made it too costly for them to continue some of their health care insurance plans. But in sharp contrast, HHS apparently doesn't intend to do anything at all about a new health reform mandate that could eventually force hundreds of badly needed U.S. hospitals to shut their doors. Now, people whine about the post office shutting. I want my post office, despite the fact that we have stamps.com. And despite the fact that it's not a life and death situation. What about your hospitals being shuttered as a result of government policy? Many of these hospitals are already struggling to make ends meet because Medicare only reimburses them for 90% of what it costs them to take care of Medicare patients. It's actually worse than that. Sometimes they're denied altogether. But instead of helping them out, this rule change does the opposite. In a misguided effort to pressure them to become more efficient, it arbitrarily assumes that they can achieve the same productivity savings as the economy at large and decrees that these hypothetical cost savings must be deducted from any Medicare reimbursements they receive after September. The trouble with this is that it lumps hospitals in with manufacturers like IBM and General Electric and takes it for granted that they can ultimately save almost $30 billion per year by replacing their workers with equipment or by squeezing their operations in the tighter quarters. Nothing could be further from the truth. Better follow me with this. This is going to affect your lives. First of all, hospitals are far too labor-intensive to be able to slash payrolls as easily as manufacturers. They can automate functions like lab work and record keeping, but there's no way they can substitute equipment for nurses and orderlies and housekeepers, nurses' aides, kitchen workers, or maintenance men. Also, hospitals can't downsize as readily as manufacturers. Hospitals that close floors have to uproot the patients on those floors and crowd them in with patients on other floors. And there are obvious safety and tolerability limits to how far that kind of doubling up can be pushed. We're making it more efficient. You over there, get out of here. Oh, look at that. We've cut things. Given these given these constraints, very few of the 4,686 U.S. hospitals, we have less than 5,000 hospitals, providing patients with Medicare Part A, that is, providing patients with Medicare Part A services, are going to be able to boost their productivity enough to make up for their new reimbursement reductions. So the government is going to screw them. You must take Medicare patients, and you must take 15% less than you have a right to. Wow, look at that. Look how Obama has cut costs. Hasn't cut anything. The government gets bigger and bigger. Its responsibilities bigger and bigger. Grabs more and more power. Invades your life more and more. And people who are not responsible for running the government are the ones who are punished, as you will be as a patient. To quote Medicare's own chief actuary, Richard Foster, I hope Richard Foster doesn't get hit by a bus or anything. I'm rooting for that guy. He's one of the few honest officials that I ever hear from. Richard Foster, he said, while such payment update reductions will create a strong incentive for providers to maximize productivity, it is doubtful that many will be able to improve their own productivity to the degree achieved by the economy at large. Thus, providers for whom Medicare constitutes a substantive portion of their business could find it difficult to remain profitable. Simulations by the Office of the Actuary suggest, he said, roughly 15% of Part A providers would become unprofitable within the 10-year projection period. So, more and more people are going to go to doctors and hospitals as a result of Obamacare. There's going to be less doctors and less hospitals and less nurses. But don't worry, that's 10 years from now. Obama will be long gone from the presidency, and he can blame it on somebody else. He's really good at that. He'll be gone. He'll say, look, this isn't the way it was supposed to work. You know, I set this up. I had Nirvana right here. Nirvana. I created Nirvana. I can't help it till the next guy's an idiot. Well, he'll put it his way, but you understand my point. And the media will be shaking its head up and down collectively. Oh, yep, he's right. He's right about that. He's historic. But anyway, I want you to think about this. Our population is going to be getting older and older, particularly, 10 years from now. More and more people are going to need services. And there's going to be less and less hospitals and doctors and nurses to serve people. What then? Oh, it doesn't matter. And, of course, the border's not secure, so illegals will keep pouring in. And, of course, according to the Supreme Court, they have to be taken care of. Oh, my gosh. You can see it, can't you? How come we can see the freight train coming right at our nose and the left doesn't give a damn? Anyway, John Hartigan at the Baltimore Sun, he goes on. This is a shocker. What the actuary, Mr. Foster, is telling us is that deducting the legislative presumed productivity savings from Medicare reimbursements would gradually turn more than 700 of our hospitals, 700 out of 4686, into chronic money losers. And while he doesn't spell out what would happen with those hospitals, eventually they'd shut down. There's no doubt that the impact would be devastating. Patients in rural areas would have to travel long hours to get to the nearest hospital still open for business. Patients everywhere would have to put up with critical shortages of beds, operating rooms, and ICUs, as well as badly overcrowded clinics and emergency rooms. You know, kind of like what happens in Britain and Canada and the other places that have embraced Nirvana. Not only that, care would almost certainly have to be rationed. Grandpa might not get his heart bypass. His daughter might not get her mammogram. His grandson would probably have to wait months for surgery to repair a sports injury. Writes Hartigan, a Chevy Chase resident, former vice president and general counsel of Technicon. Despite all this, HHS has no plans to intervene. Brushing off the actuary's warnings, his superiors insist that the new Medicare reimbursement reductions won't cause any harm to hospitals or the communities they serve because hospitals can become more productive if they invest in system changes. Now that's just bureaucratic posturing. In order to survive the reductions, a typical 200-bed hospital would have to achieve long-term productivity savings of about $7 million per year with system changes. That ain't going to happen. And they know it ain't going to happen, and they don't give a damn. These people are committed to government-run health care because of what it does to you, the citizen, because it obliterates the U.S. Constitution, and it transforms our society. Remember what Berwick said, the guy that runs Medicare and Medicaid now? This is about redistributing wealth. That's what it's about. You folks are going to be punished. And according to the left, you deserve to be punished. You've had it good enough for long enough. Now they're going to fix things. You know, if you read the Communist Manifesto, oh, there he goes. Really, if you read the Communist Manifesto, you'll understand all of this. Even some on the left who are unwitting adherents in one form or another to the Communist Manifesto. The great Whittaker Chambers made the point that, and I paraphrase, liberalism is just another form of communism or Marxism. It really is. If you think about it, just listen to the way the left speaks about the successful, about redistributing wealth, about more government intervention, about tax cuts for the rich. These are all Marxist-like fortune cookie talking points. Where else did this come from? Anyway, we're going to have less hospitals and less doctors, ladies and gentlemen, unless the Republicans get the courage to actually try to defund Obamacare. Obama, I read, is also going to spend the next several months trying to convince you what a great deal this is for you. You just remember these hospitals. Very, very expensive medicines for rare diseases. All this stuff's going to be on the table. Dislocation with respect to hospital personnel and doctors and nurses. It's all coming down the pike. If you can tell me one damn thing the government runs efficiently other than a war, one thing, I'm open to hearing it. I'll be right back.
Mark Levin.
Well, if you think you can escape to Great Britain, healthcare will be better there. Well, obviously you know better. This from the Daily Mail. Thousands of older cancer patients are being denied potentially life-saving surgery because of ageism in the National Health Service. The chances of being operated on start falling in middle age and plummet for those in their 70s and older, an official study shows. Experts blame age discrimination and poor access to specialist opinion in some areas. I blame Marxism-socialism. You folks, I hope you understand, particularly with liberal representatives, what they're doing to you. They are dragging you into a medical gulag that you can't possibly comprehend. Lines, Palin was right, death panels, lack of access. You better pay attention. We'll be right back.